All right.
Welcome back to Medical Monday.
Yes.
This week we're going to be going over endometriosis. So this occurs mainly in women 25 to 35. However, it can occur at any age. It is just endometrial glands and stroma outside of the uterus.
Yes.
It happens about 10% of all women. And it does about a day or two before menstruation, normally is when it occurs, and it can last for several days afterwards.
Yes, absolutely. A lot of hormonal association with it. That's why it's before, during, and then also a few days after.
Estrogen-dependent, hormonal, benign inflammation.
Yes. Yes, that's the way to put it. Very uncomfortable. My sister's had it, but the female organs, you have your uterus, you have your fallopian tubes, and then you have your ovaries. And so with that, what happens is the lining of the uterus comes out of the system and lands essentially anywhere in.
You see it attached to the bladder, attached to bowel. Mainly it does stay within the pelvic cavity, right around the female reproductive system, but it can go into other organs, into the lungs, to the kidneys. It can migrate because of this tissue is just within the cavity of the body.
Correct. Yes. So very common, especially more anywhere in the abdominal area. And really, it's very uncomfortable. That's really the only way to say it's very uncomfortable.
Anybody who suffers from this knows it's very, very uncomfortable and very worrisome because it's on a cycle, which is your period, you know. So whenever you're going through menstruation, that is when it occurs. And it's that worry, like, oh, it's going to occur, it's coming, and that dread. Yep.
Yeah, that's exactly it. So what are some things that we can do at home to help calm this down? Just some home therapy, some things to help with the symptoms themselves. Oh, we already talked about all this, the endometriosis and what it is.
So that's a representation of just kind of how it gets out into the system and where it goes.
So this is the female organs themselves.
There's a theory of the retrograde meniscus, but the retrograde period. So that's where we thought where this would come from, is that when a female has a period, that it would go throughout the abdominal period or the abdominal space, which is not the case, because we actually see this in younger children even before they've had a cycle. And of course, it even occurs in women beyond menopause. So they're not having a cycle, but they still have these symptoms that come. So it's not really associated with leakage of the period into the abdominal cavity, but we do see it mainly within that region.
Most common, yes.
Most common.
Yes, absolutely. So now let's talk about some things that we can do at home so that we get some relief. First and foremost, hot baths are amazing because they do help to increase blood flow and really vasodilate vessels to allow for better soothing and really they're just comfortable. They calm things down. And you could also do or add any types of salts or scents that help you to just calm and be collective.
Because we know it's a benign inflammatory process. So with any type of inflammatory process, what we want to do is calm that down, whether it's through a nice warm bath or if it's a cold compress, or anything just to relax that area so that inflammation is not causing discomfort.
Yep. And there's a lot of equipment out there that exists that's specifically designed for the lower abdomen, and whatever works best for you. There are some people that will prefer the cold compress because it helps longer, or they'll prefer the hot baths because they're able to sleep through the night as they go through that process. So it is definitely just things you can do at home to help. The other is a support group. One of the absolute best things to find are people that have things in common with you, and endometriosis is one of those. So if you suffer from this, those people deal with a lot of the same symptoms and might have resources or things that they've done that have helped. So support groups are great.
That's where all great tips and ideas come from, is from a support system, and also knowing that you're not the only one going through this. You know, we talk about 10% of all women do have this, and it's very painful. So you shouldn't suffer alone. Oftentimes, just being able to talk to a friend or a family member who has this condition can ease your mind, even though you still have the symptoms, but it just feels better to be able to talk to somebody. Oftentimes with chronic pain, we do see depression set in. We do see, you know, a lot of other issues associated with it. That's why it's great to have a support group, not only for the support, but also the good ideas. You know, I may have an idea that Dr. Gabby didn't think about, but if we sit down together and we brainstorm, you know, we can come up with things together, what works for her. Maybe she takes turmeric, maybe she does some other activities.
Yep.
Maybe she likes heat. Maybe I like ice packs. That's the thing of having a support person so that you can bounce ideas off of each other of what works for one. Maybe the other person can try that as well.
Exactly. Absolutely. We are all very different and unique individuals. And that's why it's great to have that and talk it through, find out what worked for somebody and be like, oh, well, that didn't work for me at all. So yeah, I like it. All right. Well, some of the other things we can do is reach out to the medical community, right? There are specialists, OBGYNs, that take care of this for us, but some people might have a PCP that they see, nurse practitioners. There's a lot of different medical providers out there that help and support through this. And so there's different ways to approach it.
We know it's hormone based.
Correct.
So there's a couple of medications we can do to help manage your hormones.
Yes.
And then of course, we've got over the counter birth control pills.
Yes.
We've got IUDs, we got some Nuva rings.
rings.
This the good thing about the IUDs is that it just stays within that region. So if you're having endometriosis and it's just within that region, it's good because that's the only place that the hormones go. They don't go all the way throughout your body. So they're a little bit safer than your birth control pills, which then affect your blood pressure, your cholesterol, and of course, even risk of cancer, depending on if you're a smoker also. So there's a couple of different options, a couple of different avenues that you could discuss with your primary or your OBGYN to try and help with this.
Yes, see what is best option for you. There's also some minimally invasive surgeries. So this is an image of the same thing, actually pre-surgery, and they're using some scopes to help remove the tissue. And then this is afterwards. So really just going in there gently as possible, and removing the tissue that is the problem, essentially the endometriosis that exists inside the abdominal cavity. Again, there's a recovery aspect to it, no matter how minimal any surgery is, but also a lot of people get some great results and great relief from this. And it's really a matter of what is the best option for you, and your provider will tell you that. And then lastly, hysterectomies. There are a lot of different approaches and also a lot of different procedures and options out there as to what part you can remove, what parts stay, and different there. So it really depends on your case, how severe it is, how old you are, how young you are. And so there's a lot of different factors.
A lot of different factors and options. We look at the hysterectomy in itself is typically just the uterus. However, we know this is a hormone inflammation, a hormone dependent inflammation, and the hormones come from your ovaries. So ovaries very rarely actually have endometriosis. However, since they are the driving force of the endometriosis flare-ups, oftentimes those are taking along with the uterus itself, because that is, even though it's tissue that's outside the uterus, it's normally causing the pain, that would just be part of it that they would take. So very helpful to take what causing the inflammation, the hormone producers, the ovaries, and then also where that inflammation is actually at, that can be taken surgically. But of course, there's always age, there's risk factors. Are you done having children? Do you want to have more children? What are those options, questions, concerns, or something you should really sit down and think and discuss, not only with your primary or your OB as far as what path you want to go down, but then of course your loved ones will also help be able to guide you with that.
Yeah. Loved ones are very important because they will help you, and they help you talk about through everything that he talked about. Do you want to have more kids? What age group are we in? Where are we at in our lives and aspects there? So that is our Medical Monday on endometriosis. I hope you enjoyed every minute of it, talking about the
rather unpleasant condition, but about 10% of women suffer from it. There's things we talked about you can do, and of course a great support group, and then if need be, the medical community's got some great specialists to help you out as well.
Yes, absolutely. So until next time, everybody have a wonderful week, and we'll see you next Monday.